Okay. Hi, everyone in the room, and welcome to everyone who is joining us online for this BRC bite-sized seminar on how to set up patient and public involvement activities. And we have three speakers today. We have, and please correct me if I'm mispronouncing your surnames, I should have checked this before. We have Ben Jevons, did I say that right? Yes. Deidre Layden, perfect, and Polly Livermore. Sorry, I realized I only had Polly written on the notes. So Ben is a postdoc researching development of the, oh dear, there are a lot of complicated words here, enteric nervous system in health and disease, and developing stem cell therapies to restore the enteric nervous system when it is lost.
They in English that later, won't we?
Deidre is the GOSH Patient and Public Involvement and Engagement Manager for Research and Innovation, and her role is to support and facilitate a culture of community of PPIE in research across GOSH and ICH, and supporting researchers to enable patients and the public to further improve the quality and impact of the research that we deliver. And then Polly is a senior nurse at GOSH and an associate professor at UCL, and the NIHR GOSH BRC PPIE co-leads. Polly has many years' worth of experience teaching, supporting, and delivering best PPIE practices, and she is currently chief investigator for an NIHR-funded co-designed study called IMPACT, which is delivering an intervention to support parents of children and young people with chronic health conditions. So, and I should say, I'm Ania Zylbersztejn, and I'm here on behalf of the BRC Bite-Sized Steering Committee, but sadly, my co-leads are all either sick or away, so they're sending their apologies. But without further ado, it's my pleasure to hand over to
Thank you, Ania.
first.
Thank you very much. And I know that you've done a lot of PPIE work yourself, coming to GOSH YPAG, etc. So
yes, so what have done without your help?
Yeah, so all working together. So yeah, I'm just going to kick off really. Ania has introduced us just to have a little look at what is patient and public involvement and engagement. We never expect that anyone who's coming to these sessions knows what it is, and that's absolutely fine. We're all here to learn together. I'm going to look at different ways to carry out patient and public involvement and engagement activities using the research cycle. So some of you may have seen this, the National Institute for Health and Care Research has a research cycle, and we use it a lot when we're thinking about matching patient and public involvement and engagement activities to it. There are so many different ways to carry out patient and public involvement and engagement. So today we're going to focus in on focus groups. And this is why Ben and Polly are joining us today to talk about their experiences doing that. I'm just going to look a little bit with you about what a PPI focus group is. We're going to then move into Ben giving his experience of actually setting up and running a focus group, thinking about impact and involvement all the way through it. And then we'll finish with Polly, who, as Ania said, has got a lot of experience in patient and public involvement, looking at her impact research project and kind of just reflecting back on Ben's session as well and pulling together the picture. This is an informal session, so anybody online, if people want to ask questions or raise your hand, please do so. I know that Vanessa will be checking that as well, so we want to make sure that you're included online. And this is something that comes up with focus groups as well, whether to have them in person only or hybrid. So that can be a little bit tricky to manage like today. So we need to keep making sure that our people online are included. So you're not here in the room, but you're here with us. So I'm just going to start.
Is it around?
Okay, this one?
Yeah. Let's double check this is working.
Can I check? Are we okay to take pictures?
Yeah, that should be fine. Yeah, that's fine with me, but I don't know. Lovely. So what is patient and public involvement? And I know I was chatting to you outside a little bit about this already, getting our heads around what you're doing, and you're very new to patient and public involvement, aren't you? So this is what the NIHR says it is, research being carried out with or by members of the public. And we say public, but we're always thinking about patient within this as well, rather than to, about, or for them. We'll probably send out the slides afterwards as well. So don't worry, but do take screenshots, that's fine. We'll send out the slides afterwards as well. And it's people sharing their views and experiences just to support researchers, to help guide and inform their research, how it's designed, carried out, shared, and put into practice. And we see it as an active partnership. And we hope that it will influence and shape research. But importantly, we have to show impact all the way through from what people are saying and how they're being involved. There isn't any one way of involving patients in the public and research. So you'll see from Ben and Polly this afternoon that they have different ways of approaching it, and that's absolutely fine. And also the level of involvement and the stages of the research process are different, so they can change by nature of the research project or as the research project evolves. So you can have people very involved in the beginning, less involved all the way through. So it's very much a sliding scale. If we have a look at the bottom left, you can see the UK standards for public involvement in research. These are, we use these to guide our patient and public strategy. So we very much align our PPI strategy to these standards, and we look at them throughout any of the research projects that we're involved with as well. This is the research cycle I talked about. So we're just going to click through and just have a quick look at patient and public involvement activities throughout the research cycle. Before that, just a little bit about patient and public engagement. So there's Ben running a patient and public engagement session, and we'll talk a little bit later about the circle of involvement, how it can actually start at an engagement session where you're actually out there doing an activity, sort of a tabletop activity with patients and the public. And this was at our Rare Disease Day event last year, and it can actually start to begin a conversation about new research or actually disseminate research. So it's got a sort of a great way of using that space. I don't know if you want to say anything about that, Ben, just about how you found this.
Children are much better at puzzles than I am. I designed that puzzle and it took me about 45 minutes to complete. The pieces are around 6 inches square, and that little girl did it in about 5 minutes. It was very, very embarrassing. It also showed like the kids are quite capable and very happy to participate, almost more than you'd think. So I think as they perhaps grow up in a hospital environment, they're more familiar with a lot of the terms than you'd expect, and they're quite switched on and happy to be engaged.
And I think as well, just how we'll talk a little bit, we'll touch back on a little bit of plain English in a bit, but this was how we sort of set out what Ben will be doing, find out which cells are missing and how we're trying to replace them. So a lot of it is about messaging as well. So once you start to talk about involvement and engagement, it's about the language that you use so that you're not sort of putting a barrier up to people getting involved in the first place. And so interactive activities are a really good way to kind of break down barriers as well. If you want to talk about your research, it's quite nice to have something to talk with, so you can kind of have that conversation, but you're actually doing an activity with people. So if we look at the research cycle, can you keep me to time, because I'll just talk and talk and talk. I want to make sure that Ben gets his chance. Very briefly, you'll have these slides afterwards. You can see how much can go into PPI activity against the research cycle. We talk about how important it is to start your PPI from the beginning, and that could just be about having a conversation about the research topic that you want to look into. Is it good? Is it not? What are we doing? How are we going to do it? Start that conversation early. These are all the ways you can do it. You can look at existing reference groups, hold an event, a workshop, a focus group that we're going to look at in more detail in a little bit. Go outside of your organisation, attend meetings by health condition specific groups. We talk a little bit about to researchers about having an independent facilitator to do this so that the researcher doesn't take over the agenda too much. There's ways that you can conduct PPI surveys and interviews, but this is to inform the research. It's not research itself. People get very confused sometimes about when PPI becomes research. So when you hear surveys and interviews, your head kind of goes straight into research and participation, but this isn't. This is about PPI informing that. I know that some people have co-applicants on funding applications. Somebody who was at the steering committee last night was talking about having a co-applicant from the beginning of their project, which was really, really important. Not always possible. Commissioning is a step up from that, really. We don't do a lot of PPI around that, but it can mean having members of the public on research commissioning panels or boards, so they're actually involved in that side of things from the beginning, and involving them in the monitoring process of the research once funded. Designing research, this is where a lot of PPI activity can come in. So whether you're holding a workshop or a focus group or online involvement like today, reviewing proposals, looking at plain English summaries, looking at the feasibility of the research design, commenting on patient information sheets, looking at outcome measures. We do an awful lot of that with the GOSH Young Persons Advisory Group. meeting, how meaningful and reliable these outcome measures might be for patients. Do you need to change them as a result of speaking to patients in the public? Looking at ways to ensure diversity and inclusion are addressed in the research. We find the YPAG are really good at looking at that. They'll actually do that themselves without even having a researcher add that as a question. They'll start talking about that with the researchers. And then ensuring your recruitment process is practical and feasible. Ben is going to touch on this a little bit later, just to demonstrate to funders and commissioners that the research topic is important. I think that's something that came up for you. And you can work with your PPI group to actually reinforce that, taking on their opinions. You can take the research proposal or the materials to a health condition specific patient or public involvement group. Sometimes that's really important to come outside of the advisory groups and actually look at the health condition itself and speak to people who have lived experience of that. And then come to our in-house groups, as I've mentioned. So we've got the parent care or the young person's advisory group. In terms of managing the research, you can look at, again, sometimes there's an overlap of, there isn't one steering group for one thing or one focus group for something else. It can depend on where you are in the research cycle. You might want to open a steering group or a committee, and that would be looking at shaping the research methods or steering the project through its cycle. So you've got people from the very beginning as more sort of a steering role. In terms of undertaking the research, now we've done a little bit of this with young people where they became qualitative interviewers with researchers, sitting with them, interviewing children and young people. And that was then helping the researchers conduct the research. We have had people co-running a research focus group. They need training to do that. So you've got to think about boundaries and where people are, what experience they have of doing that kind of involvement. Or you can engage interested representatives from your steering group or committee to work in partnership, and that will be looking at analysing or interpreting research findings. Or you could hold a small workshop or event to find out the wider audience, the views of the wider audience on the research findings. And that could be something like Ben's event in the Rare Disease Day, where you actually just touch base with people if they're coming through, the lagoon, and actually talk to them about your research and where it's going, just to get a take on where people are with that. In terms of disseminating the research, you can look at co-developing the dissemination, the findings, how best to report findings to others. People sometimes know about networks and newsletters that you won't know about, different media formats. And PPI representatives often have access to groups and forums that researchers are not aware of. This comes up all the time when people will tell me, oh, I'm part of this group or that group. Have you heard about this group that we can actually get the word out to? And we wouldn't know about that without actually speaking to our PPI reps. We have had people co-present at conferences, co-author journals and newsletter articles, and co-deliver these hands-on activities at events. In terms of evaluating impact from the beginning of your project, that's something you really need to think about. Ben's going to touch on that. You've got to think about the impact of PPI from the beginning, or what impact you hope it might make. And again, that's very flexible. It can change as the project evolves, and so it should. So it's not a fixed state. You're not coming in with a fixed idea and coming out at the end with an end product, because you're dealing with people and their opinions, and it can change as you're going through your project. But think about how you're going to monitor and evaluate this public patient and public involvement. People can get involved in writing up an evaluation of your research and helping you again with a lay English summary for that. And they can record short and long-term impacts. So just to focus on focus groups themselves, because this is what we're going to be looking at today. So really, it's a method to generate a great deal of information from a range of diverse opinions. So you're trying to focus people in. Everybody's coming with their own lived experience and their own opinions, and it's trying to focus people in through guided group discussion. Worst thing with the focus group is when you haven't got it planned right and it heads off in a direction that nobody has any control over. Not good. So you have to guide people, but also support them to share their thoughts and their feelings and their attitudes and ideas on their research projects. I think Polly will touch a little bit more on that later, because she's had a lot of experience of co-designing focus groups, etc. And the feedback from the results of a focus group, it does require some skill to analyse it. So I know Ben and I, when we were planning this session, we were sitting down, weren't we, and going, what exactly went on in these focus groups? What were the key things? What happened? What was the plan at the beginning? How did we monitor it? What came out of it? And it sounds really simple that you're just going to write it up, but it can be very layered, can't it? And lots of different voices in a room and lots of different opinions and themes coming out. but it can bring a rich source of information to the research and in people's own words. And sometimes it's a quote, isn't it, that you can use in a funding application that has more impact than actually a list of outcomes and what people have actually said in your focus groups. Considerations, develop the focus group topics for discussion in advance. So that's really important that you know what you want to get from your focus group or what you want to bring to the group. And this will structure a guided discussion. And this sounds really obvious, but the topics should be designed with the overall research question and theme in mind, which you can veer off. So you've got to really think about what is it that patients and the public getting involved in your research can help with, and what might the impact be. But think about impact from the beginning. So if we go back to slide 3, and what is PPI? It's an active partnership between people and researchers that influences and shapes research with demonstrable impact. That's what we hope we're going to get from this. We're always thinking about EDI throughout our strategy and everything that we do. And this slide just touches on the kind of things you want to think about if you're planning to run a focus group. So I'll just give you a few seconds to read that. Is there anything that's not on that slide that people are thinking we should think about? We always use these training sessions as a way to widen. You missed anything? That was just something that I came up with. Anybody online?
There's some advertisements about how you get people in the room first.
How you get them in?
Yeah. Who's
Yeah.
actually showing up for focus group. Obviously, there's things about barriers to those that are choosing to be part of that team. How do you get people
To get there, like today.
Yeah, exactly. Yeah. How do you advertise? Who do you advertise with?
Well, that's really good because you're going to speak about that, aren't you, with your flyer idea
Yes.
and how that changed. Ben has the answer to that one, but yeah, how you get people there in the first place, yeah. And again, that comes back to the whole plain English and the language you use and how, how you don't want to overwhelm people with what's going to happen at this focus group. The other thing we say to people a lot is because we know what a focus group is, doesn't mean that your parent or patient has any idea what you're talking about with the focus group, and they might feel like it's an what is it? So that's really important as well, that we don't take for granted that people understand what it is we mean by it.
Could there be something, I mean, it's sort of covered, but making sure that we come back with what we did with, I guess, a year later or however.
Yeah.
Because there was a little bit at the bottom about the feedback, but I guess, yeah, just making sure that we communicate what we did and how it was useful.
Yeah, and I think we talk about that as well, don't we, about where your group has evolved to. But yeah, definitely, there's nothing worse than if you were to join it's like coming along today and then say, we'll send out the slides and we don't. Or if you had a question, we don't answer it because you feel like, well, I've wasted my time, or these researchers got what they wanted and they left. And we hear that a lot with groups outside sometimes. Somebody said, Have you had that experience? Yeah. And we just forget, people forget sometimes. They're so happy to have this focus group and then it's like goodbye and off you go. But actually these people invested time. And again, with the focus group, we talked about people maybe moving into a steering committee. If you kept in touch with people who attended the focus group and then you want to set up a steering committee, you're going to have a much better chance of keeping up the engagement with these people because you've kept in touch with them. You're building your own PPI community than just taking a load of feedback and saying thank you, goodbye, and that's the end of it. So yeah. So I'm going to pass on to Ben. And when you're talking about accessibility and the whole sort of reaching out to people, if you notice on the screen on the setup slide, we had Ben's very formal photograph, so it was sort of professional. But when we're working with patients and the public and they've never met this researcher before, it's quite nice to have a more friendly, accessible photograph of Ben and
Fergus.
Come on, who doesn't want to meet Fergus and Ben to come to a focus group? So going to pass on to Ben to just talk a little bit about what he went through. It wasn't too painful, was it, what you went through to set up your focus group? That one's done, yeah.
Okay. Thank you, Dee. So that was actually something that came out of the Young Persons Advisory Group. We asked them for specific feedback on everything we'd presented. And one of the key things they said was the photos that we'd given were too professional. which I'd actually done deliberately. So I'd taken pictures of myself in a lab coat, so I could be like, look, I do the stuff, I do science, like you can trust me to do it. And they get that all their lives. That's not what they want. They want to know you're a human. They want to break down that barrier. The dogs thing actually was a tip I found online for running focus groups with children. The children will tend to get quite stressed. And so a key thing I read was if you allow them to involve their pets, or if you maybe bring your pet into it, it helps break down the barrier and show that you're a human being, not just another white coat. Anyway, I'm going to run through my experiences. I am by no means a PPIE expert. We set up this focus group with a lot of help from Deirdre. So rather than me giving you my expertise, this is more my experience of what went wrong, what went right, mostly by luck and guidance. And hopefully you'll get something out of it. So the first thing that we asked for help from Deirdre was about writing a plain English summary. So by this point in our lives, like a lot of us are very, very used to writing these dense scientific abstracts, which are almost impenetrable to a layperson or anyone who isn't even in your field. So I sent very early drafts to Deirdre, who ripped them to pieces. And now when I look back, it's almost cringeworthy how horrible they are to read. And I'm pretty sure that in 5 years' time, I'll look back at the ones that I'm so proud of now, and I'll think again, these are awful. But here, the thing to focus on, does this have a little pointer, or is it?
Yeah, it does.
This thing?
Oh, but not really.
No, broken it.
Top button.
Top button, okay. So one of the first things is like, if we're writing scientific abstract, you're trying to sell it. So you'll use quite hyperbolic language. It's devastating. There's a traumatic effect for the patient. Whereas the people who are involved in this probably don't need that. They already know it's not great. And it's just kind of ramming it home for them. So you can lose things like that. This whole section here at the bottom for the people online, and the third point in the scientific summary, that's justifying why the enteric nervous system, the nervous systems, the intestines that I work on, why that's important. It does all this stuff. But again, you don't need to justify that to the people who live with it on a daily basis. So all they want to know is a plain English summary, as we've now gotten on the right. And that was something that was quite surprising. I gave a presentation in the second meeting, I think, and I gave a sort of my cartoon version of this is what happens in Hirschsprung, and one of the children emailed afterwards and said that they had never had it explained to them in a way that they could understand before, which I thought was quite brutal considering they've had that disease. I think that one was 13. So a very quick look through this, because I think there was an excellent summary of this a couple of sessions ago, right? And that's been recorded and uploaded. There was a whole session from the junior faculty on how to write plain English. But Deirdre helped us write this one. And something that was surprising to me is you can put scientific jargon in there if it's important. You just have to explain it immediately. And then maybe you don't need to keep saying congenital. Now you've done it, you explained it, you know what it means, they know what it means. Now you can just say things like happens at birth or born with. So you can keep it relatively jargon free. It does take up a few more words, which can be challenging, but I think they're valuable. So there were certain words which I would have thought would be absolutely fine to include. So for example, I thought contractions would be an absolutely fine word, and everyone would know that because of pregnancy. Apparently not, which maybe says other problems in our society. But we found saying squeeze works. You can say squeeze, and it gets the point across.
I think the important thing here with the plain English, we say this to people, that then the template, you've got that and you can repurpose that. And when you're going out to speak to people about your focus group, you then have something ready that you can use in your information, as you said, how do we advertise the focus group? It's all there to help you. So it does take some time to do it, but then you can use that for advertising your focus group, or even bringing your patients and public into your focus group. So you've already knocked that barrier down with your focus group members because you have it in your plain English.
Okay, I think that importance goes through right to the title as well, although for very different ways in my experience. So the initial title that I wrote is on the left here, and I think one of the key things that was wrong with that was I said exchange research data. And this caused me probably the worst panic attack of my life at one point, where quite late at night, I found an email that had been sent to me from someone in the core research coordinating team, and they had asked me if I'd done the ethics for my research project. And as it was quite late, I freaked out and I thought, oh God, no, I haven't done any of that. And it's quite far gone. We've had the first meeting. It's a bit late now. And I was panicking to the point where I was like, okay, I've clearly done something very, very bad. I didn't want to email anyone because I was like, then it's in writing and I've acknowledged what I've done. So I was sort of texting Valerie Karaluka like, hey, you around for a quick chat? And she wasn't rarely on that day, she couldn't respond. And then I went and spoke to someone there like, no, you don't need ethics for PPIE. But that one email, which had been flagged because the word research was in the title, caused me a good day of thinking like, oh, that's probably the end of my career then. So making that clear and just remembering you do not need the
But you obviously need to think ethically.
Yeah.
So you don't need to actually go and get ethics, but obviously, yeah, you into it. But yeah,
No, I mean,
language, so important, language. Come back to that again and again, don't we?
Yeah, for sure. I did even write a sort of consent form and a sort of summary forms for the people who are involved. You don't need that, but I thought it's just sort of laid a groundwork and made it very clear to everyone. But this is sort of how you're going to advertise your focus group to people as well. So it is again important that it's very understandable and immediately obvious. So I applied for a little bit of funding for this through the NIHR GOSH BRC New Projects Call. The reason I wanted funding was to reward the people who were involved for their time. So although I wasn't, renting facilities or really paying for snacks or things, I wanted to give them something for their time because, they're taking time out of their busy lives. These people are parents, so they don't have oodles of spare time, and it's quite difficult to manage. One of the participants has 3 children under 6. It's hard to manage those and be participating in this. So a little bit of reimbursement for the time that they're giving up. And we've also, the reason that number looks quite large is that we also allocated a little bit of travel money in case any of them wanted to attend the final meeting in person. So we had 3 meetings online so far. The 4th meeting should be in person, although we have pre-meetings, which I'll cover later on. And it turned out that one of the participants had been so traumatized by the in and out of hospital nature of their lives for the first few years of their child that person now has trauma about going on trains and public transport. So we have decided to keep all of them hybrid. So there'll be the option to attend in person, but it will be.
So you're thinking of your EDI there straight away then. So you're thinking about inclusion.
Yeah.
Straight away there.
Got to make it so that anyone can feel like they can participate. So that figure was also arrived at very carefully based on, there are guidelines that you can look up of how much people should be reimbursed for their time. So that information is all out there. We applied purely for a PPIE activity. So you have to show that your research aligns to a theme. I actually for theme put patient and public involvement and engagement, and that seemed to go through okay. The other good thing about applying for a bit of funding is that it sort of forces you to do a lot of the planning and the scheduling and look at how each meeting is going to go, because just saying it's going to be PPIE doesn't mean that it will be funded just for the sake of doing PPIE, although maybe that should in an ideal world. The people that fund this want to know it's going to have an impact, and they want to know that you've thought through what it's going to do. So for example, I had to write a project timeline of which meetings are going to contain which questions, what will be the deliverables of each meeting. That helps to focus you. It also starts highlighting how much time you need. So for example, I'm sort of jumping around between my experience and the key takeaways, but I presented the plan to the Young Persons Advisory Group. This is what we want to do, this is what we want to focus on. And then that does start building up a serious time commitment, because you've now got to write the application, also write a presentation for the YPAG group, present it, analyze it, change it, adjust it. Like even just for this part, there is a serious time investment. It was well worth it. but there was
It's like building blocks, aren't they? You're sort of building blocks towards the focus group. So you sort of start with the white paper, then you have to prepare a presentation for that. You may as well do that properly and have your proper plain English, which you've done already, and then that's all used. But also, if you look at the project timelines, so Ben has to actually have this funding spent by the 31st of March 2025. So for that, the project timelines need to align with this as well. So yeah.
Yeah, for sure. There is a lot of time. I mean, when you write this timeline, this has to include sort of involving people as well. Nearly used the word recruit there, so I will also use the wrong words many times, and Deirdre will probably catch me up on it. You can see I've also recorded most of these meetings, which I'll go over later, and listening back to yourself is the most horrific thing. And you can see sometimes that I went to use at one point disseminate, then remembered that's probably a bit of an unnecessarily jargony word. So I changed it to share, but then in the recording, you just see me obviously struggle to come up with the word share, which doesn't do great things for the ego, but it's valuable to record yourself and go through and keep trying to work at it. We also did manage to involve a layperson with Hirschsprung disease, which is the disease we focus on in our applications. They were there right from the start. And that was incredibly valuable because having them go through the application, they pointed out two key things which really did shape both how we ran the focus group and our long-term plans. So the first one was this person mentioned that Hirschsprung is an invisible disease. So they've had the experience before where they've been with their child has tried to go to the toilet. Hirschsprung disease is one that will affect how you go to the toilet and can get pretty serious if they don't have very ready access to go to the toilet. And the child was stopped from using the disabled toilet, and they had to then produce a card. So that's going to have serious impacts, I would imagine, on the mental health of the child, that they've had to justify why they have to use a disabled toilet, and also very, very stressful for everyone involved. So knowing that, and with that experience in mind, we could sort of build that in to the justification of why the PPIE is important, and in future why the funding is important for this sort of work. That same person also mentioned that one of the most valuable things for patients or parents of a newly diagnosed child with Hirschsprung disease is someone 10 years down the line who's already gone through what they're going through, which seems obvious, but that's had serious impact on the way we've run this, which will come up later on, and you'll see how things have changed and shifted just as a result of that point of view. It didn't even happen immediately. The first point immediately got incorporated into this funding application. The second point was sort of percolating in the back of our heads, and we only really started actioning on it once we'd already started the focus group. I think I've gone through it. Okay. So these are the aims, which is sort of, again, how we're selling it to people. So this part on the left, there's 6 individual points, but essentially what we were going to do was show the people involved our research. This is everything we've done. This is everything we plan to do. Is this what you want? Do you like this? Are you happy with this? Is there something you'd rather we're focusing on? Are there things we don't know about the disease that we should be focusing on? We wanted to get their opinions on specific parts of our research and also any new things that they could add to us. In the last meeting, we're planning to focus a little bit on clinical trials, which we're not at that stage yet, but we're at the stage where when we apply for funding, we need to show that that's something we're considering and that we've thought long-term. If we're going to go down this route, what do the people who it would impact the most want? How do they envision those trials going forward? What do they think the endpoints should be? So we wanted them. And the other sort of deliverable that we put in is that we plan to use all of the feedback we get from this group and drive that forward into future grant applications. So generate deliverables. These people have raised that this is an issue. We will now pursue this.
But this is very early PPI then. So F is really, in a way, it's very early PPI for the next 2-3 years. So you've actually started some very early patient public involvement. That's the future.
It was quite a nice pause to do this research, this focus group now, because we just reached a nice point in our research. We'd published one paper, which was like our major finding so far, which showed sort of the feasibility of our stem cell approach, is good. And it was a nice point to be like, okay, we've now done this bit, it's got this far, are we focusing on the right things? But as you said, it was at a point where we're applying for the new grants at the moment, so we can get this in at the early point and use it to shape the grants. And having all of these points was something that I used when I approached the potential members. So I emailed them all. I did. I will be called up a lot. I'm, as I said, not an expert in any of this.
No, you're doing great.
I can show you what not to do. So when I emailed everyone and sort of asked them if they'd be happy to take part in the focus group, I gave them sort of guidelines in a more sort of expanded version of this, if this is what we want. And that does kind of block you into a contract. It's a loose contract, but you do now have to say, you do have to hit these points more or less.
So it's focusing you,
yeah,
isn't it?
It does. It locks you in, and it means that then when you're planning about the meetings, you know, okay, these are what we've got to hit, which all makes sense. How do we manage that in the time? And that's quite important because the focus group, so we had in total 12 people in our focus group. We had 4 families, each of which had 3 participants. Sometimes it was the 2 parents and the child. Sometimes it'll be 1 parent and 2 children. But that's still a lot of opinions, and an hour flies by when you have to use. So we'll get to it later. I used the first 5 minutes of the meeting for one thing. There should be a 5-minute wrap up at the end. Then you've got to give time for any technical issues or anything like that. That time can fly by. So having a plan of what you're going to get out of each meeting is crucial for making sure that each one is efficient and you get what you need and you don't waste too much time. I think that's covered everything important there. But obviously, if anyone has any questions or any point or wants to refute anything I've said, then please feel free. The main EDI work that I did for this was to send out the emails in advance and offer a pre-meeting. So I did this, I can't remember if this was suggested by Deirdre, it probably was, a pre-meeting for just 15 minutes, just to, essentially I wanted to use that to break down the barriers. So to sort of explain to them, this is what's going to happen, this is the process, do you have any questions, is there anything you want to raise? That was very important, as it turned out, for a few things. One, I think someone already mentioned it, that people in focus groups like to know where it's gone. And someone said that quite pointedly, that they'd been a member of a focus group before and they'd never, ever heard from them again. And they felt a bit used. They didn't get to see where it had gone. So we then took that, and for the rest of the meetings, we've made sure that we're constantly feeding back, this is what we've done with the information from the last meeting. We hope that it will go on even further and we'll keep in contact with them, but now we know they would like to know the impacts and the results. A second point very specifically was one of the children has developed a phobia of needles. And so we couldn't use any pictures of needles. I emailed back and forth and I said, just to clarify, are cartoons of needles okay? And that actually was fine. As long as we gave them warning, that was okay. So we sort of, it allowed us to set boundaries and things. Interestingly, that member's sister, who isn't affected by the disease and hasn't had much experience with needles, now also has a phobia of needles, just from hearing about the impact that it's had on her brother. And there was, that was it. And the one of the focus group participants also mentioned at this point that they didn't like to travel because of the aforementioned trauma. So that gave us a lot of information just from those pre-meetings. And it also helped break the barriers down and give them an idea of, you know, this is who I am. This is going to be informal. There's nothing that you need to prepare.
I think also visually as well, if you're working online, I found that when I do the GOSH Young Persons Advisory Group, I know them all, but even still, your head, when you're looking at a screen and people join a meeting and you are worked up, you know, you're ready for that, your adrenaline's up, you're ready to, and suddenly all these different, and even if you know the people, it's like, who's that? Who's that? Who's that? So if you've met people beforehand, you kind of have an idea that, okay, that's that family, that's this family. we all kind of know each other.
Yes.
Because your role is introducing them to each other as well. So if you're sort of sitting there
Exactly.
going, I'm not quite sure about it, what was that about? So that was a really good, yeah. And I think as well, it's a really good way of just sussing out what's going on for people sometimes, and what do they understand is going to happen at this meeting. It's not a complaints meeting. It's not a consultation. All of that. So you're kind of laying those sort of ground rules as well with people. Yeah.
Yeah, laying the guidelines down, definitely. I mean, one of the things that we emphasize very clearly and very early is that this is not a support group. And that can sometimes be tough, because even knowing that, and we've sort of said that, I mean, I spend 5 minutes at the start of every meeting. I think Dee actually copied that basically verbatim from one of the guidelines I sent out. And I say, this is a variable disease. We want to hit everyone's contribution. Which was particularly important actually, is in one of the pre-meetings, one of the participants who has had the disease for I think nearly 4 decades and now has a child with the same disease, he used the specific words, I feel like a fraud, because he no longer had any symptoms, which is rare and great for him. Whereas a lot of the other adults still had the symptoms, and his child had the disease far more severely than he ever did. And I think it's important to make it clear that we need that outlook as well. We need the whole thing. We can't just have, oh, these are the people that are very severely affected and feeling their symptoms. We need everyone's input. So that was important. We also used the sort of pre-meeting and the sort of a 5-minute intro at the start of every meeting to say, this is going to be recorded and this is why, which is important to justify, not just say like, this is going to be recorded, you have no choice. We also gave them the option to opt out, and we informed them it would be. We said it's to make sure that we can capture everyone's opinions. So when we have these meetings, I'm normally sort of chairing it, and then Conor McCann, my PI, is furiously scribbling notes, and he's there so that he will sometimes intervene if he thinks that there's another point that he can make. Mostly he's there writing reactions and making sure that everything's captured, which seems obvious, but I mean, like even with the video recording, what I found is that the way Google Meet records it is it focused on the person's face who's talking. And what you then lose from what we can see during the meeting is everyone else's reaction to whoever's talking. So for example, at some point, Conor had scribbled down, everyone else nodded in agreement. And that's important because I would have lost that on the recording. And like something that Conor has started using for a different group of meetings we're in is an AI-driven minutes recorder, and it's fantastic. It really accurately summarizes everything that was said, but it loses the context and the emotion, and it can't say if people's body language showed, well, no, I don't agree with that, that's crazy. So we explained that sort of that's why, much more eloquently than I did, we explained that's why it was recorded. We also made it clear that it's confidential environment. Nothing that is expressed by anyone in that digital room is going to be used by us with any identifying information, and they also can't do that. And that was clear to set out the guidelines. Here, the sort of second to last point, I have to be honest, I got incredibly lucky, I think. Every family that we've asked to be involved has been incredibly engaging, really nice, very kind, congenial. They do not interrupt or talk over one another, which was something I was concerned with. So I'd read loads of how-to guides on focus groups, and there was things like, if one person is absolutely dominating the meeting and they're not letting anyone else get a word in, then you can say something along the lines of, oh, that's very interesting. I'd be keen to know if anyone else in the group has had a similar experience, or if you had a differing experience, and try and sort of move them along. And honestly, I haven't had to use any of them. Everyone has been absolutely lovely. So I think it's good to have those tools in your pocket in case you get someone. But we've all been fine. So every meeting I say sort of, please raise your hand. It's fine to disagree or agree. You don't all have the same experience, but we always need to be polite to one another, especially as in my one, there are children. So you can't swear or something or anything, which was, I'm quite sweary, so that was a problem for me. The final one for EDI is how-to guides. So I ended up writing more of these than I was anticipating, because we work through COVID with a lot of these online digital meeting platforms, but it doesn't mean everyone else has a job that also uses those platforms. So I had to write a how-to guide for Google Meet, which revealed to me that I don't really understand how Google Meet works. And then you have to put in like screenshots, and there's even things like I wrote some surveys after the meetings, and not everyone's computer will open it in the same way. So some people have the easy select a box and tick option, some people can't, and that almost wasn't expected. So for some of them, they found it easier to just print it, tick it, and send a picture to me, which I'd said in an email, like, however is easiest for you to do, as long as I get the information, I really don't care. Okay, so these slides now are the specific meetings that we've held so far. We've held 3 now. I think when Deirdre wrote these slides, I'd only held 2. But essentially what we have is sort of the plan, and then here is what actually happened, which I think most plans, once you actually put them in, you plan a plan for ages, and then when you enact the plan, everything goes to hell in a few minutes. So that's the plan, the aim, what we expected to happen, and then sort of what actually came out of it. So the first meeting that we had loosely outlined as it will literally just be an icebreaker. We just want to get everyone talking, comfortable with one another. And we had I asked everyone what their favorite superhero or book was, so that the adults could be boring and say a book, and the cool children would give their superhero. Well, most of the adults actually gave a superhero, which I was quite interested in. And to sort of get the members talking, asked this question: what is something that scientists might not know about living with Hirschsprung disease on a day-to-day basis? And the reason I asked that was one of the goals that we had set ourselves of running this focus group was to develop a set of FAQs of what it's like to live with Hirschsprung disease. That sort of morphed while we were writing it, because originally the sole purpose of this focus group was going to be, we want to present our research and get feedback on the research that we've done and our future directions. And then while we were planning it, we had feedback from a grant application, which made it clear that a misconception exists that once a child has had surgery for Hirschsprung disease, they are cured. And I don't want to belittle the surgery. The surgery is life-saving. Without it, the children will die. It's a very black and white situation. But that doesn't mean they're cured. They do still have a lot of symptoms that they will live with, often for the rest of their lives. And we decided that we could use this set of FAQs that we'd originally envisioned to actually address that more important point, that we can raise the knowledge that it's not done after the surgery. And that's actually something that the members very enthusiastically, as it turns out, agreed with before we'd even planned it. So they've used words like the myth and the idea that this is a cure needs to be deleted. And they're very keen to engage with that.
So you're kind of thinking about the research aims there already in a very, so not in a straightforward way, but that's interesting, isn't it, in terms of impact, in terms of the impact of patient public involvement. That's happening within this conversation at the very beginning.
Yeah.
And thinking about future research. So as we said, it's not one size fits all, and it's quite, because you're dealing with people, aren't you, as well? So their lived experience is, you're using that to then think about future funding.
For sure, yeah. I mean, it evolves, and it does end up affecting almost every impact of your research. So from this, we've got, we get information about future research directions, like new projects that we could work on, some of which were very surprising to us. Some is just, as Deirdre mentioned, like direct quotes, like the one who said, it's a myth, this needs to be gone. We can apply for that. And then when the research funders say to us, this isn't something that affects them, we can say, well, this person who has the disease begs to differ. So even if that was all we got out of it, like all of this planning was just a direct quote, I genuinely think it would have still been worth it. But one of the ways that this aim to develop this set of FAQs evolved was we now have realized that it's more impactful based on what that original participant said about the most valuable resources, other people who've had the disease 10 years down the line, and from work Connor's now done with Guts UK, the charity, is it's more useful, rather than a set of FAQs, to have a patient information sheet that anyone can receive when they're newly diagnosed, and it will say, this is what life is going to be like. The surgery will save your life, but you will probably have these outcomes which you will have to deal with. And that will help stratify patient care. They'll know what the likely timeline is and the trajectory of their disease. So it'll be good for the patients themselves when they're newly diagnosed. It'll be great for us when we're applying for funding. So that's sort of evolved as we've gone along. Okay, so this is the second meeting. So in this meeting, we wanted to present all of our research, the current research that we've done. Have I run over time?
I think you have about 10 minutes, so just to give you others.
Including Polly's?
We'll manage it.
No.
We'll manage it. We've got till 3 o'clock, haven't we?
Yeah.
Or we can whiz through.
Right? So you have 10
Yeah.
minutes.
10 minutes. Okay, I'll fly back, and I can also just stop at any point.
So it's not really good. Yeah.
Thank you, appreciate it.
Yeah, it's fine, yeah.
So in this meeting, we just wanted to present our research and have their feedback on it. Originally, the idea was that from this, we would get 3 actionable points of how we could better advertise our research moving forward. So if they'd like to be kept up to date with everything that's going on, how would we do that? Sort of keep the PPIE ball rolling. And then it occurred to us from the first meeting that this makes sense more in the third meeting. We'll ask that question. And in this one, we'll focus on, this is what we've done. What else would you like us to do? And here we started sending out surveys after the meetings to make sure that everything was captured and that we got everyone's point of view. And something that was really interesting was we've spent all of our research efforts to date focusing on motility, how to get the gut moving again after Hirschsprung disease. But of all the questions we asked, the only other thing that got mentioned with as much regularity and frequency as motility was pain, which we had never even focused on at all. And then when I look back through old RNA-seq data sets that we've got, the pain pathway was coming up, and I thought it was just a sort of erroneous thing that was being flagged up. Maybe neuronal pathways have got conflated. So again, like, it's now opening up new research avenues that we wouldn't have even anticipated beforehand. And we've now begun a collaboration with Professor KP Harron, who also works at UCL, and she's using the eChild database so that we can look at a wider network of how patients with Hirschsprung disease live their daily lives. And this is something which we've already reported back to the focus group to say, like, this is now being taken on in this way. We're hoping to expand our knowledge of what it is like to deal with Hirschsprung
Really good
disease.
example of patient public involvement in research. I mean, that's amazing. And then what you were saying about feeding back to people, so you're keeping them on the journey with you and saying, this is where we are now. Surveys in between, so we're all so not just the meetings, in between even, you've been in touch with them and letting them know next steps.
Yeah, absolutely. And that seemed to be a very important aspect for them. So I think in the interest of time, I'll skip the last meeting slide because I don't think this is too important. And I'll just finish on this one, the key learnings. So in terms of unexpected outcomes, the major one I would say is that we presented all of our future research projects to the focus group. That was including things like, here's the stem cell therapy we're developing. We're trying to find the optimal source of stem cells. Another one was we're looking at the other nerves that are involved in Hirschsprung disease and how that may cause some of the symptoms. And the reason that some therapies may not work is because they're not addressing those. And we also presented that future collaborative work that we're planning to do with Professor Katie Harron. And surprisingly, that was the most engaging project for the focus group. So the thing that they wanted more than anything else almost wasn't research into developing a cure. It was just to have it acknowledged and to have a more formal basis of this is what your life is going to be like, so that that could be fed back. So they almost wanted to make sure that no one goes through what they'd gone through ever again. And that was quite unexpected to me. In terms of what I would do differently, we put surveys, we sort of shoehorned them in halfway through or after the first meeting, because we realized that we may lose some people's points of view and we wanted to make sure we were capturing everything. So we sent out these sort of post-meeting surveys to make sure we got everyone's views. If I was to do this again, I would send those surveys before the meetings as well. I'd bake them into the plan, because we, for example, asked, how do you feel about stem cell therapy after we presented? If we'd put a survey out before, we could have asked, how did you feel then? And we could have seen if it evolved, and then that would have been further justification for PPIE to show that it has helped improve the way people look at the science. In terms of what I learned, it takes a lot of time. So when you add up like preparing for the YPAG presentation, developing a flyer to advertise to families, approaching families, asking if they'd like to be involved, writing all of the pre-documents, planning the meetings, having the meetings, the surveys, analysing the survey data. It takes a lot of time. I don't think I anticipated until preparing this presentation. I don't think I recognised how much time I'd spent doing this. And a lot of it was in the evening, like all of the meetings are in the evening. They're between 6 and 7 p.m. Because people obviously have busy lives to work around. So a massive time commitment, but also incredibly valuable. I mean, you get a sort of tsunami of information in every single meeting. Like there's quotes that we're plucking out like, well, that's fantastic. Other bits were like, well, we had no idea that was a symptom. Now we can focus on that. So you gain a lot, but it does take a lot of work to do it. In terms of where to next, initially, we're applying for a research grant. We've got a meeting later this week with the NIHR Research for Patient Benefit. The idea for that is that we will sort of say to them, we would like to develop everything we've learned in the focus group and take that forward and find out exactly what impact having Hirschsprung disease has on the mental health of a child, on their future hospital visits, the effect it's had on their education, and have that in clear black and white writing for when we go and approach funding bodies, and also so that we can offer that information for parents who've had children that are recently diagnosed, so they get a more realistic view of what life will be like moving forward. We're also hoping that we can keep these families with us. A lot of them have expressed already interest before we've even asked them about staying in contact. Like in the last meeting we had, one of them, she made a pointed suggestion of it would be great to have other clinicians and scientists come on and be involved in the running of any sort of patient advocacy group, because they've had those sort of patient advocacy groups in the past that were run purely by the parents, and they found that they really struggled to keep up the momentum, especially as they were reliant on support of local businesses and things, which takes a lot of time, and obviously it's not their jobs. They have jobs and other things. So we'd like to sort of evolve this into a patient advocacy group and help that they can keep sort of pushing the research and helping to shape it long term. So I think that's all of our next plans. I think I've already covered the note on the ethics, and I think that is me done, right?
Perfect. Thank you. And
Right
this-
on time. Sorry.
and this is just a slide for some online resources for people that want to have a look. Yeah, that was amazing. Thank you, Ben.
Thank you.
Still on the journey.
Now you're on the journey.
Questions
Stay on the
again?
journey. Shall we use through pop? We've got 5 minutes. Has anything come up for anybody online, or anything you just want to reflect on or mention to us? A lot of information. How did the December meeting go then?
Really well. Each one has been better than the last, and that one was incredibly helpful.
And they're probably gelling as a group as well. I mean, you probably found that with yours. People start to gel as a group, get to know each other, and yeah,
feel more comfortable.
How did you get your families?
Again, I have to say it was quite lucky, because we didn't struggle at all, which was no skill. We had professional people approach them in most cases. So there was one that was already involved that Connor knew from his involvement in other research projects, and we sort of asked if that person, their family, would like to be involved. We had a professional connection where we knew someone's family member was affected, so we asked them to reach out for us. I reached out to Joy, one of the head nurses over at GOSH, who approached another family for us. And we wanted to get a spread of family groups. We didn't just want them all London focused. So we went to Sheffield and we asked them if they could recommend a family. And there was sort of a long email chain of us emailing the person we knew, who emailed the person they knew, who then reached out to the patients. So it was all done very professional. I mean, we actually developed a flyer. The original reason we went to the YPAG group was we developed this flyer that was meant to advertise, and we thought we'd have to hang that in hospital things and have that given. And everyone just immediately said yes, which I guess reflects the willingness of the community to engage. But I think
the importance of connections as well, isn't it? And who you know, but yeah, that was one thing I was going to bring up. Yeah.
So you moved, sorry if I missed this, how big is the group now?
it's still 12 participants. I mean, there's 4 families. And when I say 12 participants, like it's a congenital disease. So some of it's parents, and then sometimes their children have it. Sometimes the children have newly got the disease. The 12 people, some of them are very young children. So something we have found difficult is maintaining the attention of children online. The 13-year-old watches the entire thing. The 5 and 6-year-old will occasionally go and play with a Spider-Man toy, and I can't blame them. I'd probably rather do that too. So if we were to redo this or take it further, I'd maybe try and look at more ways that we could better engage the children as well. But I mean, even just with the parents and the older children participating, it's still a lot of points of view to sort of field and shape and direct.
And parents are kind of representing the children as well, and sometimes kids, they're hearing it all, they're listening to it all. So
Yeah.
you know, but when they hit 12, they can join GOSH YPAC as well. So they can get involved in our community. But yeah, that is something to think about. But that's the other thing about planning for focus groups. You can't just decide next week I'm going to have a focus group. Oh, I haven't got anybody to come. Oh, now I need to go out and find people. So that was again, how many emails back and forth?
Yeah, quite a lot.
About getting your group together, and then all of that. That's a big thing to think about as well. Okay, so we'll move quickly on. So this is just a quick Q&A between myself and Polly around Polly's impact study, and I learned a lot from actually looking up the information on this, which I meant to do ages ago and never got around to it. So it was great when you sent me the poster to sort of learn about the project. Do you want to just talk a little bit through what the impact study is about, Polly, to begin with, and then we can think about your PPIE throughout it?
Yeah, thanks, Dee. So I'm Polly, I'm one of the co-leads for the PPIE for the NIHR BRC. And I'm doing a postdoc study at the moment that followed on very nicely from my PhD. So rheumatology conditions are chronic health conditions that generally don't have a cure. And families live with these for many, many years. And children and young people go on into adulthood to cope with their conditions. So what we wanted to do from my years of being a senior nurse in the trust was to work out how we could better support families. So how can they live with their condition day in, day out for the child and young person, but also for the parents. My PhD was more looking at the child and young person perspective. And this study has now moved into more what we can do to help the parents. Because if we can strengthen support around the child, then hopefully their coping and their strategies will improve upon, especially when there's very little psychology support and social work support in the UK. So this study is co-designing an intervention to support families between appointments.
Right. So this was very much a co-design process for the research, wasn't it, really, from what I got from it when I was looking it up. So where are you sort of so far then on this journey?
So we've talked quite a lot today about the research cycle. So obviously making the research relevant and important to families, I think, is one of the most important things. And this need came out from what parents were saying to me after the PhD. So actually the idea for the whole study came from a parent. So this was way before even applying for funding. And I've got a good group together that followed on from the PhD, and we were sat around talking about whether we would give support to children, if we'd give support to parents, and how we'd do that. And there was a father on there from America at the time who was talking about using a chatbot intervention. So as you know, from the old paperclip, dancing paperclip, you ask it questions and you get answers back. And he felt very much that there were many, many reasons why this would be useful. I don't particularly like chatbots. I had to go away and do a SWOT analysis to work out what it could actually bring. And actually, I got the funding the week before ChatGPT hit the news. So the world is in a different place now. I mean, the advantage is everybody knows what a chatbot is. But so the study was in 4 phases. So we were having, so this is research, okay? It's the difference between the PPIE and the research, but we were starting off with design, where we were having focus groups, which is where I often use the term discussion groups for PPIE rather than focus groups for research. But we were having focus groups with children and young people to work out what the content would be into the chatbot. And then phase 2 was very much developing it and what it would look like, and then pilot testing it, and then we have a feedback event. But it's very much led by the steering group, which I think are on the next slide.
You mentioned about steering groups earlier, what they are.
Next one.
So this was the co-design process, really, what you've gone through for the research itself. And you can see the plan. So again, we talked about that, about Ben's session of work, that it needs to mirror the research. So any PPI you're doing, whereabouts in the research will you hit with a PPI? So this is the research.
So I think this is my most important slide because these are my fabulous, this is my fabulous PPIE steering group. So we've talked about EDI quite a lot about how you get that representation, and I really wanted a couple of males in there. You know, I wanted a father's voice because we all know that it's mostly the mothers that bring these children to clinic, but really wanted a range of different people, different experiences, different places across the UK, different conditions, different ages, children, young people that you can see here. This is Era, she's absolutely fab, and she will not let her parents be involved in the slightest. This is her project and her thing, and whenever we do any kind of Zooms or meetings or whatever, she shuts the door. When we had our workshop, she wouldn't let her parents come, so they had to drop her off and go and shop around London for the day. So she's got arthritis, this one's got lupus, this one's got JA, and then that one's got JDM. So we've got a range of different health conditions, different genders, different perspectives that they each bring to each of the meetings that we've had. Oops. And so the research, phase one, from the schema that I showed earlier, was this is research, this is what we wanted to collect, what the chatbot will include. But I think what's really important for me is every single one of those members of the steering group was at one of these focus groups and co-delivered it. So they sat in the room and they asked questions as well, and they were part of the group. You can see there some of them were face-to-face, some of them were virtual, and we had a real range. But what was really important, so you saw Era on the other slide. So Era's 12, she was 11 when she started in the study. So actually she came along to the girls group because she was there on the same level as the girls were. So she could ask similar questions about what was important and relevant to them. And then the older young adults, for instance, they fitted into the young adults group, that the dad came to the dad's group, you know, and actually it worked really nicely because they were there with two kind of hats on. But what was really important was to make sure that they understood why they were there, how they were there, and supported them to do that to the best of what they wanted to do.
A lot of people, probably, when you look at the numbers there, 14, 8, 9, 5. Is everybody else looking at this going 9, 5, 11, 8? Oh my God.
1,740.
Yeah. So that's a lot, isn't it? So you've got obviously a group of people supporting that background.
Do they come at the same time or different? How does that work?
So the focus groups here, so these were different dates. So for example, we had, what does that say, 6 in April. So 6 here. And so they were on different dates in April. Does that make sense?
Or different dates. So did they come as a group or as individual?
So these are, so 5 youth workers came as a group. We had 5 of those, they were virtual. And then these 11 health professionals were in a room in London together, a range of different professions. That makes sense?
So that's a big, yeah.
But that's the research.
Yeah.
But what we're talking about today is the PPIE supporting the research, which is where the steering group fitted in. So then moving on from that, and same as Ben's done, I've continued with my fabulous, wonderful group, steering group. Phase 2 was a workshop in London, which we had in May this year. And the research was that families came, so they saw the flyer, they scanned the QR, they signed up for Eventbrite, and then they came along. But the steering group each led a station at the focus group. So we did Word Cafe methodology style, which is where you have lots of different tables and you have one host who stays on that table and everyone else, you research people rotate round. And so each of the stations was led by a steering group member. And they each had a different focus. So there was a different, so here we were designing what the chatbot might look like. What would the logo be? Would it be an animal or a robot, a male, female, whatever? And then we were doing about frequently asked questions. We were doing some work with ChatGPT to understand about the different perspectives. But they were all led by PPIE.
So that was patient public involvement, co-leading the actual workshops. So you're bringing them right in to work alongside you.
Yeah. So, for instance, we had one mother, Rachel from Nottingham, who kept putting herself down. Oh, I can't do this. I'm not capable of doing it. I haven't got experience. She was very, very anxious. We spent a lot of time with her beforehand. We together worked out what her perspective would be, her focus. And then we helped her and prepared her. And on the day, kept checking in. Every single station had a GOSH member of staff with them to take minute notes, but they were there for support, basically. And if there were any problems, they were happy to step in and help with that. And we had these bubbles where people would go in and type questions to each other and have an argument between a parent and a child. And we had one of our mothers run that station really nicely. It was really
So
good.
you had your Connors in the room as well. So
Yes.
you had the people taking notes. Yeah. Keep an eye on it.
So moving on, this is where we're at now, which is about testing the chatbot. And what we've actually done is, so the chatbot will be tested next year for the whole of the year with parents using it. But our steering group members, our super users, have been testing it for us in the background. And what our chatbot actually includes is a parent response and a healthcare professional response. So the parent response is really empathetic in the sense of, so if you type a question into a chatbot, so my child is struggling with needles, what can I do? You'll get a medical response that will talk about Emla, Ramatop, all that kind of stuff. And then you get a parent response about, well, I spent a bit of time with my child before we came, we played around with needles, we played with a sibling, whatever. And so they get two different type responses. Our parents, our super users, our steering group have written the parent responses that are in the chatbot. So they're all real life experiences. Which really does come out. And the other thing is they're leading the competition to name the chatbot. So the steering group are leading it and coming up with suggestions that then the public is voting for.
So when you say patient and parent voice, the research, you're actually getting their voice. You're actually hearing them, which is amazing. This brings us nicely back to the UK standards, which was on the very first slide at the beginning.
I think it just shows the journey. We've talked a lot about engagement and support and collaboration and partnership and being on the same page. And I think that's really important, and it's spanned kind of throughout the study so far. Yeah.
I have a question. I think it's a question that kind of goes throughout all of your presentations, but with families being trained and participants being trained to lead how did you go around training the parents? What's involved? What are the challenges?
I think it's a really good question, because all of my steering group members have come with different experiences. So one of them is a charity worker. She works with families all the time. She's on the phone to families in the middle of the night when they're struggling. So she has a really different perspective. She's been involved in things like this before. And so actually with her, it was a one-to-one conversation, just understanding what her questions were. And then you've got the children, where you're thinking about their development age. What do they understand? How can we make sure that they're safe, that they don't feel upset about talking about their own, hearing other people talking about their condition and then it causing upset in them. So it was very much an individual thing. Generally, we offered group sessions where we would get people together, but we would always follow up individually with what else do you want to know? What's specific to you and your journey.
And that just makes me think planning. Like you said, time, how much time goes into this and planning it. So even, having a one-to-one with somebody, you have to set that up. Email them, when are you free? That's all time. I'm probably doing that on a massive scale.
And it was also important because obviously the children are at school. So thinking about, and the parents didn't necessarily want to do it in the evening because they've got other children there. So it was really trying to work out. We spent a lot of weekends on the phone. We still spend a lot of weekends on the phone with families.
I think sometimes we think, like Ben, you were saying that your sessions were in the evening. And we always think, the evening is the best, but it's not always the best. We found out with the steering committee, didn't we?
We did.
When is the best? It's so hard to know next time, but yeah.
So you don't have a single answer.
There isn't one answer. There isn't.
But also it's your group, isn't it? So you get to kind of know your group. So I knew, for example, the steering committee yesterday evening, I know there's a young person. I pretty much was sure she was going to turn up. I knew she was never going to email me. She's just going to turn up that evening. That's her style. She'll just zoom in. She's there. Hello. She shouldn't take to tell you that she's done it. But you still send out the invite anyway. You send out the Zoom invite anyway. But yeah, it's get to know people and what they need. And you can't please everybody. There's not. You do your best. Duty calls. So you live by, isn't it? Duty calls.
But that was it, really. I just wrapped up. I think one thing that was really important for me was that ownership and passion, which has really come out from the families. So I didn't talk about it, but we got together as a face-to-face group before we even started this in London, and they got to do icebreaker games and talk to each other and form a bit of a bond, so they felt supported, so that when we're on a Zoom in a year's time, they don't feel silly to ask a question that they don't think is important. So I think that ownership and passion is really important, and actually they are they're the ones championing the study. You know, they could run with it. If I got run over by a bus tomorrow, it'd be fine. So yeah, what works best for them, being flexible, the training, and I mean, one of our mothers comes from Nottingham, you know, which is what, a good 2 hours journey away, but will still come for face-to-face meetings, want face-to-face meetings. So it's not necessarily that it's always virtual's best. And then, yeah, feedback, communication, which we've touched on.
Just to wrap up before any questions, just from hearing about Ben's experience, Polly, like, is there anything you'd like the audience to take away today? Or the two of you can do this actually. What's kind of come from even just speaking today, Ben, when you've sort of spoken it all out? What would if you were to go back to yourself and say, right, what would you advise yourself before you started this up? Think about. You can't say never do it, don't do it.
No, I would definitely do it. It's been incredibly valuable. Probably I would have known in advance that you don't need ethics and not have that heart attack inducing evening, which is a complete waste of time. Yeah,
that's a good top tip for us actually. When we're meeting people to talk about their PPI, maybe to stress that a bit more. I need to remember to say that a bit more. People don't end up down that road.
I think you're also, I've heard stories from my research team of people being asked to do ethics for PPI, and so maybe there's some confusion around what requires ethics and how PPI, as in from the, I guess, the team that would be, I don't know, maybe there's some sort of feedback you can give and say, this is very different.
Yeah, because probably you say you're doing PPI and you did made a switch between research, but including the PPI people. So it's quite hard to like.
It's really hard. It's really hard. And Dee and I spend hours talking to people about. They'll come to you and say this is PPIE, and it's like, no, it's not. That's research. That's really research.
It's so important. So even when you say participant, your head just goes, okay, now hold on a minute. You said participant, but do you mean involvement? But also, there's no one size fits all. So like Polly's project's really interesting because they're there in a bit of the research, but then they come out and they do this little bit, and that's patient public involvement. So you've got to kind of just be really clear about what's the research. Yours is a bit more very much more straightforward.
Yes.
But then what is where they're influencing the research? Yeah.
Is there any way that in your study body that you can like kind of summarize which part of your work has been researched and which part has been made?
Yeah, I can see it really clearly. Yeah, I think
maybe that's a good point as well. Where we just need an A4, where we just say this is and this isn't. But an example.
There is a really good paper on it that is exactly called that. What's the difference between PPIE and research? It's really good. I can send it on.
When we're taking people applications, we have to direct people to governance, and we need to know which ones.
I think if you're going to report on it as if you're going to kind of use it as findings, that's different. But it's blurred, yeah.
But writing up the outcomes of whatever you want to call it from a focus group is not research in itself, unless you're calling that a research project, which you could be. It could be research in itself, but that's different. But if you're going to use the findings to say, or not the findings, I'm using the wrong language, but you're going to use what was said, what was discussed, and what came out of the discussions, and how that's going to change your research, then that's patient public involvement. But that's, you can write that up, but you're not going to publish it as a research paper. It's not research itself. Because if it was, you'd be getting consent from people to actually.
Well, if you're including in your, I don't know, discussions, say these results align with what we've heard through public engagement for this project, or would that already be research, or would that still count as PPIE, and where you're just putting it in context?
No, I think that is, because that's why you're doing the research. Because you PPIE people have said this is a problem and we need to look into it. So I think the fact that you've got is absolutely fine. Yeah,
that's cool. Influencing the research, but yeah, I think we've covered everything else.
Is it tough for the people involved to keep taking off the PPIE hat and now they're almost researchers and keep changing roles? Was that something that they struggled with?
They're not researchers in my study. I think they know that they're not researchers in my study. They've been involved in the sense of helping shape, helping direct. I'm not giving them questionnaires and asking kind of how do you feel now or what's changed. It's more about what they think is important that we need to be looking at.
It's very co-design, isn't it? I think yours is very co-production.
Mine's kind of based on experience-based co-design to a degree more than anything, I think, and that's where that kind of follows through. And then we also have done a video, we're doing trigger film at the end, which is where they're talking about their experiences of being involved.
But yeah, it is tricky. And again, that's down to the person as well. I know that somebody else was running a focus group and they had a parent that was going to co-run the focus group, the patient public involvement focus group with them. And the boundaries issue was a big one. So you had to sit down and I had to sort of sit down and go like, this is your role. You are not the research, because her child was so affected by this disease. Of course, she was totally involved in it. Why would, totally engaged in it. But it was like, your role here is not this. Your role here is, and so it was a lot of training around, this is how we're going to run this group. Facilitation is a skill in itself. So I think you say you're new to it, but I think you did really well. I think you did really, really well, because if you've held that group and got that feedback from them, you've done well, I think.
100%,
definitely.
Yeah.
And obviously you and Connor working and co-facilitation is so important. I mean, how we work today, this is co-facilitation. Polly and I do a lot of stuff together. It's how you work with the other person as well. Connor knows his role, he's helping. And that sets a scene as well for a focus for the members to feel safe and feel contained. And that's really important as well, because it's an emotional burden on people as well. You're asking them in a way to sit on their shoulder, think about the condition and how it's affected their child, and then give you their involvement ideas for your research. But you understand that. Right? Some people won't understand that. So that's, I think, why focus groups run well.
Were there any questions?
Any questions online?
No. But I have that's okay. I just wondered about smaller scale PPIE activities and if there's any ideas for that, because what you both presented is obviously fantastic and you've established a group and you've got a long-term relationship, but for like a small project, like for myself, I'm a PhD student and I'm just one little thing that's not really related to the rest of the research group, there's already an established PPIE group for the main themes of the research team. So I would love to do something just for this small project, but I don't know if there's any ideas you have about smaller scale or less long term things that are still like really worthwhile.
Do you mean by using like the YPAC? Or what group?
I in terms of like presenting consent forms and communication, I can see how that would be a great use.
You can have a one-off meeting. You don't have to have, as you said, it's not one size fits all. It's about what's working, what will work for your research.
Yeah.
So you don't need 4 meetings and you just need to touch base. What will probably happen though is that you'll get interested people and it'll evolve.
Yeah.
It's something more, which is good. But then you have your group then. So if you had 4 people in the room and you just sat with them and you just talked to them and said, this is the patient information sheet, what do you think? So it's not, we call it, all of this wording as well, focus groups and workshops, and a lot of the time it's a conversation. So if it's something that you just want to sit with people and have a look at, then you run a one-off session. In terms of numbers, so you had how many in a room, a virtual room? 12?
12. Well,
so if you're on your own,
including Connor, so.
Yeah. So if you're on your own doing this, we always think if you have 2 people, it's really helpful if you can have another person there. Would you have somebody that would support you?
Well, not like obviously, but I haven't got very far with this.
Yeah, and that's why networks and connections, like your connections to find your patient public involvement representatives.
But Dee
connections all the time.
Dee does a really good presentation on preparation beforehand, because you don't know if someone's going to get upset on the room, or someone's going to suddenly drop out of your Zoom meeting and you don't know if they've gone. And then having that ability to take someone into a separate breakout room if you can see someone struggling, all that preparation I think is really important. And so if there are 2 of you, it just shares that load a little bit and you can kind of watch each other's back while one's presenting and one's... And
also disclosure, so sometimes somebody might disclose something and you think, well, I don't want to carry that away with me, or did I hear that properly? Just for safety, isn't it? Just as well, it depends on what you're doing, but get in touch, we can have a chat about it. And then sometimes, as Polly said, people do come to the GOSH YPAC, the Person's Advisory Group. If it's just sometimes even just to do as you did, do the PPI for the PPI. So sometimes people come and say, we're thinking of running this session, what would work, what wouldn't? And the young people will say, well, that's too long, and you shouldn't have that there, or, so, get sort of a plan in place. But yeah,
Shelley's got a question.
Oh,
On time as well. Yeah, go.
sorry.
No, it's fine.
I was just thinking, how do you know, like, how do you get the right idea? Because I work in a critical care environment research, and it's so difficult to like find the kind of like to find idea and then to involve patients and parents.
Do you mean a research idea?
Yeah, like how not just research. How do you like involve parents because they're so emotional? How do you approach them? With it's so hard to get consent. How do you involve parents?
To support with getting consent even. So are you thinking about getting consent for studies?
Consent is fine. We're managing it, but to set up focus groups.
So you have to think why you need the focus group in the first place.
Okay. Right.
Which sounds like, yeah, so
Right.
yeah, it's like saying, let's have a party, but we don't, the birthday, what is it, why are we having it? It's no one's birthday, why do we need that? So it's, yeah, you have to think about where's the need to begin with.
Okay.
So it sounds like, from speaking to you, it sounds
Yeah.
like all patient experience, what you were doing.
Yeah.
And that's a separate thing, so that could be around a supportive group you might be thinking about,
Right.
not sure.
Well, I've run this with my team.
Yeah.
But yeah, fine.
Yeah,
If it's more patient experience rather than research, Kate Alton is the
yeah.
patient engagement thingy lead for
Yeah.
nurse consultant lead in the trust. Might be worth dropping her an email, Kate Alton.
It's an interesting point because when we talked about Ben's from the beginning, his A, B, C, D, E, F, that's what set up his focus group in a way. He pulled in, what am I doing? How is this going to follow through? So you need to
Like
know.
the families with you, like you Ben can follow them up. Whereas in the critical care environment, they're so stressed.
Yeah,
We don't know, like it's so hard to like
Yeah.
get parents involved.
yeah,
And it's not right for us to like
Yeah.
approach.
But I suppose that's why you're doing it.
Yeah.
So, for example, if it's to understand about, I don't know, how many mirrors they need up in the ward, for instance, you could do that after families have been in the critical care unit and then gone home. You know, if it's kind of, it depends what your focus is.
Okay. Right.
and to
It's
think
about
about,
asking the right questions.
It is,
Finding
yeah.
out the right
Yeah.
questions and then.
and to know, is this going to lead into anything to do with research or not? If not, it's patient experience, which is different. But again, that's about positioning yourself. So, you know, do you run something like a coffee morning that you are there solidly every Thursday, which you don't have time to do around, but you know, that, so they do that in the CRF, the clinical research facility, where Claire will have a coffee morning. So it doesn't matter if nobody comes or everybody comes, she's there at a certain time. So people know that there's that support that they drop into.
And I also struggle with ethnic groups, especially with consenting or, you know, it's a lot more difficult to get
Yeah,
ethnic groups into even like research.
yeah,
Yeah, it's true.
Yeah.
It's really difficult.
yeah.
And yeah, so something like we've improved as a team this year. So yeah, just
Well, maybe come back and talk to one of us.
Sure.
I'm conscious of time, and Shelley had a question. Shelley?
Just on mute.
Yeah, I think actually my question was answered by one of the other questions before, but because I was just also thinking, you know, what would the minimum number of say people in the focus group be for that information to be meaningful? But it does sound as though, from what you said, it just really depends on your questions, what you want answered. Because I was thinking, yeah, from listening to this, it probably is quite difficult sometimes to to get families to come to the groups, and so say, would 5 parents in my situation, the children wouldn't say they've been neurologically impaired, so it would be the parents that would be attending. So would 5 be still sort of a good group to start with, and get sort of meaningful sort of
Well,
feedback from them?
I always think about timing. So I think if everybody speaks for 5 minutes, that's 25 minutes of your focus group. Now, not everybody will speak for 5 minutes, but some might speak for more. So you have to think about the timing, isn't it? And as well.
I think, Shelley, one-to-one is an interview. more than one is a focus group. So you could have two families or two parents or two people who are just really engaged and get what you're trying to do. So I don't think it matters. I really don't think it matters. It depends on that engagement and that how much they want to
Or you run
contribute.
parallel sessions. So we, you know, or you go into like we did last night. You go into, so we had a big meeting last night, and in a way it was a focus group in a sense. So we went off into breakout rooms, but we had enough people managing them. So we split it down and then came back onto the main screen. Or whether you run, if you've got time, to run the focus group twice. So if you've got 6 people, you run it twice. 3 people, and then maybe you run a third focus group where you bring the 6 in together and you say, from our focus group meeting 1, this is what we came up with. Focus group meeting 2, this is what we came up with. Now let's have a discussion in half an hour on the next steps. So it's all about how you map it out, how much time you have.
James was on the screen earlier. He's a dietitian in BMT, and he did a really great PPIE project where he invited families on the ward to just drop into the coffee room.
Yeah,
you know, and he did a kind of tea and stuck some signs on the wall. So I mean, and whatever works for you.
Yeah.
Yeah, I work with James, so I can have a bit more.
Oh, right. Small world. Okay. So yeah, I'd speak to James about that because I remember him doing that, and it was about he's there, they can come in, he sits with them and goes through what he needs to. Person goes off. So and also that's about the EDI considerations because you're fitting in around somebody's life as well and what they can give. We don't have a lot of time. Yeah, well, that was a focus group. Again, we get bogged down in all of the terminology and such like, and you know, there's no kind of set format for doing it.
Something that we were thinking about because we've only got 4 families, it is a small number. I mean, there's something like 3,000 people with Hirschsprung in the UK, and we're looking at 7 of them, 5 sort of family members. So we were thinking about using the feedback we get from this focus group as a steer towards making a more national survey. So then it becomes a mixed methods approach. So your small focus group may only have a few people in it, but then you can use that to inform the questions that you will present to a larger population in a different format.
Well, they could support with that.
Exactly.
So you can see how it's evolving to go along. Yeah. I think that your group will stay quite, I think you'll keep those people. I think I can see that evolving actually quite a lot. So, yeah. So your next meeting, so you've had your December meeting and then you're doing one in, that's it then.
So no, February, March, and then
February,
that's
March, and
then we're done
up.
for now.
Good. Perfect. I think that's all we've got time for. We've gone over it. We said about keeping to time.
You guys hang around chat about.
Yeah, absolutely, yeah. And anybody can drop us an email, anyone who's online. Hi, Eileen. I think this is Eileen from the BRC, who's in another country. I think she's pop in and say hello.
Hi, everyone. Yeah, so I'm really glad that I was able to join online. It was a really great discussion.
All set for taking over the junior faculty next year, Eileen, then.
Yeah.
Fabulous.
Like a coup.
Taking over. Brilliant. Thank you so much, everyone, for joining us online as well. Great.
Thanks so much. It's really interesting. Thank you.
Thanks, everyone. Bye.
Bye.